So let's discuss about Pott's spine. Pott spine, or simply the tuberculosis of the spine. Now, why this is known as Pott spine? There is a reason behind that. This Pott spine was actually discovered by Percival Potts, right? So Percival Pott was the first fellow to diagnose the tuberculosis of the spine, and after his name, this is known as now tuberculosis of the spine. We all know that tuberculosis is caused by Mycobacterium tuberculosis. Now, when we talk about the tuberculosis as such, the most commonest organs involved are the lungs, right, and the lymph nodes. When you talk of skeletal tuberculosis, when you talk about skeletal tuberculosis, the most common site involved is your dorsal spine, right? Although any area of the spine may be involved, but dorsal spine is the most commonest area involved. Now, how does tuberculous bacteria gets into the vertebra? So the most common route of spread of tuberculosis, it is hematogenous. Okay, so how does bacteria gets into the vertebra? See, what I'll do, I'll draw 4 vertebrae. These are different areas which may be affected in a vertebra by Mycobacterium tuberculosis. So there are basically 4 most common ways or most common routes how they get into it. The most commonest is number 1. This we label at number 1. Most common site affected is this area, that is at the upper end or the lower end of the vertebra. This kind of vertebral involvement is known as paradiscal tuberculosis. Paradiscal is the most commonest. This is the most commonest type of involvement of vertebra. Second one can be affecting the center part of the body. This is simply known as central. Number 3 can be somewhere along the anterior margin of the vertebral body. This number 3 is known as anterior. And number 4 can be anywhere on the posterior side here. That means posterior or appendiceal. This is the least commonest involved site in tuberculosis of the spine. Now these are 4 basic areas which may be affected in the vertebra. Paradiscal, most commonest, central, anterior, or the last one, posterior or the appendiceal one, which is least commonly involved. Okay, now if somebody has a tuberculosis of the spine, how he'll present to you? So next will be the clinical features. Don't forget that this is simply a tuberculosis, right? So patient will have all the constituent symptoms that we normally read in any case of tuberculosis. So first of all will be all constitutional symptom, and we all know what are constitutional symptoms: fever, low grade, loss of weight, loss of appetite, night cries, night sweats, like that. So all constitutional symptoms will be number 1. When you talk of the vertebral involvement, patient will complain to you of pain, right? That is backache. So this will be the first symptom in relation to the tuberculosis of the spine. When you talk of the sign, first sign will be stiffness of the back. And how you will come to know of the stiffness? That will be the loss of curvature of spine. That will be loss of curvature of spine. Okay, then there can be, in the later stages, there can be deformity. So how do we define the deformity of the spine? Basically what we get in tuberculosis can be three kinds of deformities. One can be knuckle. Knuckle means prominence of one spinous process. This is one spinous process. After knuckle, it can be a gibbous. That is two spinous process. Third can be kyphus. Kyphus is three or more than three spinous process, they are prominent. Right? So these are some common signs or symptoms of the tuberculosis of the spinal area. Now, how will you treat or investigate, management purpose basically, how will you manage this case of the tuberculosis of spine? How will you manage it? Management simply means investigation as well as the treatment part. Right? So now coming on to the next point, that is management. So management first, investigations. Like we get the investigation done for any other tuberculosis case, pulmonary case, we'll start with that basically. So what do we get? Number one will be your blood investigations, CBCs, ESR, CRPs, like that. Second will be sputum examination for AFB. Number three will be your X-ray chest to have a look on the primary focus or something like that. So these are basic investigations that we do in any of the tuberculosis case, and then we include the Montague's test. So these are basic ones. Number 5, when we talk of the tuberculosis of the spine, first we get a X-ray of the spine. Okay. After that you can go for MRI to have a look on the involvement of the spinal cord if there is any complaint, neurological complaint by the patient. Number 7, the best diagnosis can be made by aspiration and sending it for culture and sensitivity. So this will show you the Mycobacterium tuberculosis, the bacilli. Okay, once you have investigated it enough, one important thing that you must always remember, the first radiological sign of tuberculosis of the spine is narrowing of intervertebral disc space. So metastasis usually don't get into the IV disc space, but tuberculosis of the spine usually shows this as the first radiological sign. Okay, how do we treat it? Treatment is very simple. Taking care of the general health of the patient, that is a normal treatment plan for tuberculosis anywhere. Treatment basically for Pott spine is simple ATT, that is anti-tubercular therapy. Right? This will heal most of the patients. So most patient recovers here only. Most patient recovers. Right? If treatment followed properly, that is one condition only. If the patient follows your treatment, he will recover very well. If he does not follow, he will land up into other complications, including the deformities, and the worst complication he can land up into can be Pott's paraplegia. Now this paraplegia is a separate topic in itself. This needs a complete detail, the stages, how the patient presents, what are the clinical findings, how it is different from other paraplegia, it behaves as an upper motor neuron lesion or a lower motor neuron. So this is a separate topic. So this is in short about tuberculosis of the spine.